On. It's now my pleasure to introduce Maggie Hulbert, who is a third-year psychiatric resident and co-chair of Health Providers Against Poverty, which is a national advocacy coalition with a broad anti-poverty mandate. She is also the winner of the 2022 Zofia Pakula Social Justice Award, which is given to an outstanding resident in recognition for their work in championing equity and social justice. So very much fitting with the themes of today, and we're really happy to be hearing about updates from Maggie's project since last year.
Great. Thanks so much, Dr. Anderman, and thank you for inviting me. I'm just going to make sure I can share my screen. Just give me 1 second. Yeah, okay, perfect. I will assume everyone can see that unless you tell me otherwise. Yeah, so thank you for inviting me, and thank you, Nassim and Gary, for that really great presentation. It sounds like the work being done at your organization is amazing, and I wish I could work there in some ways. So as Dr. Anderman mentioned, I'm an R3 going into R4 psych resident. I've been primarily based at St. Mike's. And then last year I won this award. And I will say, while I won the award as an individual, the work in which I was able to win the award was very much a collective, and it was based on the work I did with, the work we did on HPOP. And all the funds from that award actually went right back into our budget for organizing, and it has been really impactful. So I always feel weird saying I won the award, because I feel like we all won it, because it's always a collective effort. So today I was asked to present about some of the work we've been doing the last year, and in keeping with the theme around equity, I wanted to present on focusing on giving an overview of healthcare for people who are incarcerated in provincial jails, because that's been something that we've tried to do a lot of activism on, and you'll see tried and maybe not been entirely successful, but I think it's something that a lot of healthcare providers need to know more about, myself included. So just to give a brief overview of what HPOP is, it's a very broad group of healthcare providers, social service providers. We're always trying to get more people involved, and we're always trying to get a broader diversity of voices who have any sort of representation within the health and social service field. So from shelter workers, speech language pathologists, nurses, paramedics, everybody is welcome. We meet on the first Wednesday of every month from 6:30 to 8. It's always over Zoom. Well, it has been since the pandemic. And our meetings are fully open, so any new member is welcome to come. And if you want to get involved, the best thing to do is to start coming to meetings. That's what I did several years ago. I recently, in the last month, stepped down as co-chair. I did my 2 terms, and it was amazing. And now I'm serving on the board, and another psychiatry resident, Talvira, and a family medicine resident, Paige, are leading. So I'm really excited to see what they're both going to do. So we're going to talk about healthcare in prison. And I will say, since writing these slides, I have learned that prison actually colloquially refers primarily to federally run institutions, which typically have people for longer term sentences, whereas jails is the correct term for provincially run carceral institutions. And generally, provincially jails hold people who are on sentences less than 2 years, or for people on remand, so people who are awaiting trial, so who have not been fully charged yet. And we're going to get into that a bit later. But just note that I'm calling this healthcare in prison because that was how I conceptualized it when I first wrote it. And since then, I have learned that it is actually more likely healthcare in jail. And there is a bit of a difference between those 2 terms. I'll have to update these slides. So we did some actions over the last year, and we're hoping to continue in regards to the status of healthcare in jail. It will come as no surprise, I think, to most people here that it's terrible. And I will say that as somebody who actually has not actually worked in jail, not without trying. It's actually hard to get an elective to go do some work in jail, which I think contributes to a sort of lack of understanding or awareness of how it works. But most of this information that I've gathered has come from reading reports, speaking with people who have a history of incarceration, and working with community activists who have been doing this work for much, much longer than myself or HPOP. But essentially, like, this is sort of a rough formula we're going to be looking at, which is quite oversimplified, of course. But looking at healthcare in jail, we have a high-risk population, which we'll talk about what that means, as well as very poor healthcare access. Plus, I wrote in red like gross systemic injustice, so much bias, so much racism that really prevents any sort of direction being made to improve on those first 2 points, and that results in a really scary trend of people dying in jail. And that's a trend that I'm going to discuss a bit, because I don't think that's well known, but there have actually been a really drastic increase in people dying in jail in the last several years. And there hasn't been much attention in regards to this in the media, or really in any of the recent, like, we've had a recent provincial election, we've had a recent municipal election, and there really hasn't been a focus at all. And I wanted to start by talking about this case, which I think about so much, especially recently. I've been working on the Focus Act team at St. Mike's, and I think about Solomon Fakri and his family so much, especially working in the activism space of healthcare in jail. So for those who aren't familiar with this story, and it's been in the news for almost 7 years now, so I would hope that some of you would be. But Solomon Fakri was a 36-year-old man. He had schizophrenia. He was very beloved by his family, and he was incarcerated in a provincial jail, Central East. And while he was incarcerated on remand, which means that he had not been charged, and he just was not granted bail because it was not thought that he would, he didn't meet the criteria to be granted bail. So he actually had not even been proven guilty. He was incarcerated on remand, and he was unwell. He was experiencing psychotic episodes, and he was actually awaiting a psychiatric evaluation at Ontario Shores that had already been ordered by a judge. So it had been flagged that he was not well and he needed to be moved to a medical facility. And he was violently restrained, and he died in corrections about 7 years ago. There has been so much injustice in regards to how his case has been handled and investigated, and his family has been so dedicated in ensuring that some shred of justice is given to their brother. They have really been pushing, and I've spoken with some of his family just over social media, and they're so passionate about making sure that people learn about his story. So despite the fact that a coroner actually did an investigation into his death, and they found that blunt trauma from the restraints directly contributed to his death, despite the fact that an internal investigation was conducted, there were no job losses related to the people who were involved in his death. And the police actually declined to press charges 3 separate times after various investigations in regards to his death. His family sued the Ministry of Corrections, and they settled out of court for an unknown sum. So they weren't willing to go to court. And there's actually going to be a public coroner's inquest happening this fall. So I'm sure there will be a lot more news about this. And I think this is a story that's really worth following, because there's so many intersections here. This is a racialized person. This is somebody who actually was on remand and had not been granted bail. And this is somebody with a severe and persistent mental illness of schizophrenia, and he was not able to access the healthcare he needed. So there's a lot of, I think, really sad points, and this was a horrible outcome for this man. And I think this is an outcome that happens a lot more often than we realize, because there's a lot of secrecy around how deaths in jail are actually reported and who is owed transparency. So I keep this story a lot in mind, especially when I have patients with schizophrenia who end up in jail, which is not infrequent, unfortunately. So I wanted to share that story so you can have that contextual context while we talk about some more academic variables. So talking in broad strokes about healthcare in jail, so it's a high-risk population. And that means that in general, for people who are incarcerated, there are higher rates of complex chronic medical conditions like hepatitis C, COPD. The list goes on. There's so many complex chronic medical conditions that need ongoing supportive care all the time. And those are more likely to be occurring for people who are incarcerated. And then as well, you have higher rates of complex mental health issues. So people with psychotic illnesses are overrepresented in jail, as well as people with addictions, opioid use disorders, who also also require or can require ongoing medical care, ongoing primary care. And I think whenever we talk about what makes somebody high risk, it's really important to think about, well, what does high risk mean, right? It's not like somebody was born with all these high risk factors of getting COPD, of getting Hep C, of developing psychosis. High risk, I think when I hear that, I really think about it translating to like what, social adversity have you faced in your life, and that will make you high risk. So intergenerational trauma is a huge one, and Indigenous people are overrepresented in Ontario jails. Absolutely, I think all federal and provincial jails across the country. Poverty, racism, and classism, those all contribute to adverse physical and mental health effects, and housing policies. So, if you aren't able to access housing, you're more likely to be homeless. You're more likely to be homeless, so you're more likely to experience trauma. You're more likely to not be able to get the healthcare that you need. So your medical issues start to worsen over time without intervention. So high risk, I really cringe at phrasing it that way, but I think it's always important to give the context that high risk represents generally a lot of bias and a lack of equity, because nobody is born high risk, right? And this is the part that I want to focus on the most, is around poor healthcare access in jail, because this was all so new to me when I first started working towards some of these actions. So healthcare in jail is run very differently, and it comes down to something quite boring and almost tedious, which is around funding and management. So all healthcare outside of jail is managed by the Ministry of Health and Long-Term Care, but in jails, so provincial jails, it's managed by the Ministry of Corrections. So essentially what that means is the budget for healthcare when somebody's in jail comes out of the budget for the entire jail, and it's often managed by like the overall manager of each individual jail. So there's actually been like that specific point is quite important, and it's something that we have done some work on, and there's actually been tons of groups who have flagged that as an issue, that it's a real conflict of interest in regards to like where your priorities lie. And in part of our work and other work is we've compared this to your landlord managing your healthcare, right? It's like somebody who is responsible for the entire building, who's responsible for making sure things work, paying the staff. They're also the ones who are responsible for making sure you get access to the healthcare that you need. And it's very clear that there would be a lot of conflict of interest in that. And there's no real obligation to meet certain standards because they're outside of the Ministry of Health. And so with that funding management model in mind, there has been shown to be minimal access to specialist care, addictions care, continuity of care, or mental health care. I mean, I know of a couple people who do psychiatric work in jail, and a couple people who do primary care in jail, but not very many. There's also like lots of reports on like, even when the healthcare is occurring in jail, there's a lot of difficulty with confidentiality and clinical autonomy from corrections officers. Corrections officers essentially will attend a lot of appointments with people who are incarcerated, so that makes confidentiality very difficult. There are written reports of health providers being discouraged from prescribing certain medications because it could, be sold if it's a pain medication or like certain types of mood medications, or they feel like the person needs another type of medication, maybe for more sedative properties. So there's also some direct influence. And then on top of that, I'm sure many people here have had this experience. I definitely have as a resident working in the emergency room. There's no obligation for health workers or no system for health workers in jail to share their notes or records with health workers outside of jail. So there's no system possible for me to be able to review notes of what has happened when somebody has been incarcerated. I have sometimes gone through great and persistent lengths to get access to records for somebody who is in jail, and sometimes I just get one or two pieces of paper with handwriting and I can't read it. And so I have no way of knowing if somebody got a medication unless you call and follow up, and even then it can be really difficult. So the system in jail is also different. And then it's not written on my slide, but something that I've since read a lot more about is that it's really hard to retain health workers to work in jail. So there's not a lot of continuity because there's a high degree of burnout and there's not a lot of clinical autonomy. And it's a difficult environment to work in. So it's hard to have any sort of continuity of people who are familiar with the system. And then specifically for mental health care, something that I've been finding recently working on an ACT team is that there's actually no capacity for involuntary medication administration in jail, as it's not a Schedule I facility. And I think you could debate like the merits of what's more carceral or coercive than, you know, actually physically incarcerating somebody or administering medication against their will. However, we have systems in place outside of jail where someone will get the medication that they need, even if they're not capable to consent, like CTOs, or if somebody is able to go to the hospital and is found to be incapable. So you can see a situation like with Solomon Fakri, if he is, you know, ongoingly psychotic, they actually can't forcibly administer medication unless he consents to it. So, and that leads to situations where people's psychotic illnesses become worse. And that's very dangerous in jail, where there's a lot more degree of violence that can be inflicted on somebody if they are unwell and not able to oblige by the rules. And so this comes to the more recent, very scary and not well-known trend of people dying in jail. So in August 2022, there was the Ontario Ombudsman, who, I don't know if you're familiar, it's like a general complaints person for Ontario. They like manage certain provincial things. They give a report every year. They can direct change. They have some authority, but not a lot, but they sort of are generally able to collect complaints and point to gaps in our system. But they listed complaints about accessing healthcare in jail as one of their top complaints from August 2022. So 2021 to 2022. And they actually described a lot of like people calling from within jail to say they could not access healthcare, which I just find so sad and frustrating. People are using these phone calls that can be difficult to get to call an ombudsman because that's how distressed they are that they can't get the healthcare that they need. The Ontario Chief Coroner is actually launching an inquest into the number of deaths in Ontario's provincial prisons in the last 10 years because it's been increasing so much. And then this is on top of so many community and family concerns that have been ongoing for much longer than the last year. I worked with a group that was formerly called the Toronto Prisoners' Rights Project. Some of the members of that group who have lived experience of incarceration and decades of experience advocating for people who have been incarcerated. And they knew like they were keeping track of all of the deaths in provincial jails in the last year. And there's notes on their website about that because they found out from families, they found out from friends, and it was not even being published in the media. It was not being tracked. So I think there's been so many concerns raised by communities and families for much longer than these official reports. And then at the end of 2022, there was actually this really important report that came out. It's about 16 pages. It's one of the things I have a list of recommended reading at the end of this presentation. I really recommend people read because it's so well done. It's a professor from the University of Ottawa Criminology Department and some of the activists that I've worked with who've been doing this work for a long time. They essentially did freedom of information requests and tracked all of the possible reports, because this is not being done anywhere else, to see how many people have been dying in jail. And this is on the left is a graph that they show, which is talking about the rate or the deaths in Ontario provincial institutions from 2010 to 2021. And you can see that spike from 2019 to 2021. And they actually found that there was a 173% increase in the rate of deaths of people incarcerated in 2021 compared to 2010. And that's despite the population of prisoners actually decreasing. And they also found that the cause of death was the most common cause of death used to be natural causes, although that had a lot of uncertainty associated with it. But now the most common cause of death is actually overdose. So that points, I think, to a really growing and frightening need for people to access overdose prevention at safe supply, access to opioid agonized therapy in jail, and have a smoother transition accessing those things out of jail. This was a quote that they included in their report, which I thought was impactful. It's from a parent, and they say, "I'm still waiting for them to call me back regarding my son being in a psychosis before his death. I did call them after he had passed, and this was about 3, possibly 4 days after. I asked to speak with the superintendent and I'm still waiting for him to call me back. His reception asked me why I wanted to speak with the superintendent. And I said, well, because my son just died in your facility. And she said, oh, really? We didn't hear about this. I thought, well, this is strange because the whole prisoner population knew, and 5 or 6 of them called me at my home to let me know that they knew what happened to my son. And that's really a trend that I heard from a lot of the people who had loved ones who are incarcerated and who have been doing this activism work for a long time, is that the community knows. The community knows right away. The parents know. Well, it's sometimes days later, but people know, and there's real lack of action and accountability and it's really disturbing. So having reports like this 2022 Tracking Injustice report is really important to be able to have those numbers, because it's nowhere else. This is another thing that I think is really important and relevant to what's happening right now, sort of in general in politics around bail reform. I don't know if you've been hearing a lot about that. But essentially this report also found 76% of the people who were incarcerated in provincial prisons were on remand. And so remand is custody for people who are held while waiting for a court appearance or who are waiting for a bail hearing. A small portion of people on remand have been tried, found guilty, and are awaiting sentencing, but the vast majority held in remand are held in custody before their trial because they have been denied bail. And so being denied bail relates a lot to how much money you make. It's also a lot to what color your skin is, to, a lot of social determinants of health. But I think this is really key. 76% of people actually have not been found guilty for what they've been charged with. And they're being exposed to these incredibly high levels of violence and medical neglect in a lot of ways. So I think it's important to keep this in mind, because recently there's been a big push to discuss bail reform. A couple of police officers lost their lives in the last year. And I think one of them in particular, there was one, I think in the in the prairies, where a police officer died, and it was a man who was out on bail. And so Doug Ford in April announced $112 million to fix the broken bail system. They're going to form bail reform teams. And I think, it doesn't totally match up with how many people are already not being granted bail and are waiting in provincial institutions without being granted bail. So I think it's important to just keep those variables and statistics in mind when you're hearing people talk about bail reform. So now I'm going to talk a little bit about the actions that we've taken over the last year to give you a sense of, what can we do? What are we trying to do? What has worked well and what hasn't? We've been trying to direct our action mostly in regards to the poor healthcare access. In 2022, we tried to work towards an improved prison healthcare campaign, focused around the demand of transferring the management of healthcare in prison from the Ministry of Corrections to the Ministry of Health. This was a demand we chose based on, the direct asks of people who have loved ones who are incarcerated and who have been doing this work for longer than us. And also it's an action that has been done in other provinces. It was actually going to be done. It was on track to occur in Ontario prior to Doug Ford taking over the Liberal government, before Doug Ford was planning to make the switch. It's a switch that's been made in other provinces recently. It was just recently conducted in BC, Alberta and Nova Scotia also. And it's also recommended by the WHO, the United Nations, and the CCFP, the College of Family Physicians. They have also recommended that this be done, essentially to ensure that there is an arm's length distance between the management of a carceral of the jail and healthcare. So there's a lot of historical and institutional recommendations requesting this. We also recognize that making this switch, is not going to solve everything. Of course, that would be hard to do with one single action, but it was one that we felt we could actually take a little bit more. It was one that we felt we could maybe do a bit more towards. It's also notable that the minister of the Solicitor General was Sylvia Jones, and now the Minister of Health and Long-Term Care is Sylvia Jones. So we weren't sure how much action we would get when, she's now the person who's controlling. We weren't sure the benefits of switching if she was going to be the one controlling both sides, but that was something we thought we'd be able to use our voices for. So the actions that we tried to work towards this, one was we had a speaker event on essentially trying to share with health and social service providers what the realities of accessing healthcare in prison were like. We tried to have a rally twice. And I think, this reflects, I think, a lot of the essential components of activism and advocacy work is that you really have to be flexible. And I'll talk about the rally a little bit in a bit. And then we also actually were successful in writing an op-ed with myself, one of my colleagues, Dr. Talvir Mandoor, who's now the co-chair of HPOP and is another psych resident, and another person, one of the activists we worked with, Kamala Haywood, who's a person with lived experience of incarceration. So this was the speaker event that we'd organized. It was last fall. It was really well attended. We had about 70 people. Lindsay Jennings is an incredible activist who I've been able to work with over the last year, who's been advocating for people who are incarcerated for a really long time. And then James Rustin is an individual with lived experience of incarceration and lived experience of medical neglect while he was incarcerated. And it was a very powerful event. We had, as I mentioned, we had, I think, 70 people attend. And with the grant that we got, partly from the award that I won, we were able to pay both Lindsay and James $300 each, which I thought was really appropriate for the amount of work they put in and the amount that emotional labor we also asked from them in telling those stories. Hold on. Okay, so this was an op-ed that myself and my colleague, and then Kamala Haywood, whose picture did not make it onto the screen capture. Op-eds can be helpful in that they organize all of the information in one place. You can include links to your references, and you can really spell out your argument. I think as an activism tool, it really depends on how much they get read and how much they do. But I will say, from writing this op-ed, we actually been contacted by two different reporters, both myself and Talvir, to speak on, to give sound bites for people when they found out that people have recently died who in jail. So I think in a sense it helps sort of push this narrative, because one of the things we all noticed when we started working in this space was that there's very little media attention given when somebody dies in jail. And that's really not right, given that there's so much injustice happening associated with those deaths. So by writing this report, we kind of put ourselves out there as people who'd be willing to talk about it. And I think that can be really helpful and start pushing a lot of narratives. So I was glad that we were able to do that. And then I'll just speak briefly about the rallies we tried to organize. We've tried twice, and we've come pretty far in organizing them. I think rallies can be helpful in that you can have speakers, you can raise awareness, you can generate media attention. The reason that the rallies didn't follow through for us was, we feel it's important to collaborate with people who have a lot more experience and who have experience with having loved ones or personal experience of incarceration. We don't want to be speaking about this from only a healthcare provider lens. And I think by collaborating with those groups, you inherently need to have a lot more flexibility, because it's a group that has had a lot of trauma and has been asked for a lot. So I'm hoping that a rally will happen sometime in the future. Sorry, I'm realizing I'm almost done. I'm almost finished. This will be my last slide. My clinical takeaways, just for my own, how it's informed my own work. I think jail is never a safe or adequate option for anybody, especially anybody with physical or mental health issues, which are all my patients. Sometimes I hear from other providers that, well, jail is a good discharge option. And I strongly, strongly agree. And I don't think it's a safe place for anybody to access any healthcare. Family doctors have been doing a lot of the work on advocating in jail, advocating for better healthcare in jail, but psychiatrists really could play a bigger role. And it is highly likely that my patients with SPMI will not get their medications when they're in jail due to how it's structured. And healthcare in jail is not equivalent in most ways. So don't expect patients with a history of incarceration to trust you, because your role is not clear to them. And then I just have a link to some reports that I recommend reading, and I'm happy to sort of share those in the chat after. Thank you.
Thank you so, so much. That was a lot of really important information and a lot that you've been able to accomplish over the past year together with your committees and colleagues and teams. Does anybody have any questions for Maggie? We're going to take a break, a short 10-minute break, and come back at 10:30. But in the meantime, any questions at all? Okay, Maggie, if you're going to stick around for a little bit of the rest of the morning, then we'll have a chance to get back to that if people are looking for their second cup of coffee or third.
Yeah, for sure. I'll just put those resources in the chat too. Thank
That's
you.
wonderful. Thank you so much, and we'll see you all at 10:30.